Now that we've talked about the chambers and the flow of valves to the heart, now let's go ahead and talk about the blood vessels. Heart's pretty big. It has a big muscle, needs a lot of oxygen to supply those active muscles. So even if it's pumping blood, it's not going to get enough oxygen just by pumping the blood through the chambers. It needs its own dedicated arterial system and venous system to have the heart get the oxygen it needs. So it's going to get that through the coronary vessels. So the coronary are going to be the vessels originating from the aorta. And the aorta is going to have one on the right side, going from the right aorta, curving around to the right ventricle, curves around to the back side, goes to the posterior heart, and this one becomes from the right coronary, becomes the posterior interventricular artery. On the left side, you have the aorta, and it branches into this left coronary artery real quick, and then almost immediately it branches into one going on the lateral side of the left ventricle and one going down in between the left and right ventricle. So this is going to be my anterior interventricular artery, shown here in red. This other branch, the one that goes laterally, is called the circumflex artery. And it goes down and it curves around to the back side, and then also helps join and give blood supply to the rest of that left ventricle. Now, if there's arteries, there's going to be capillaries and veins. So eventually those capillaries reform into these veins, which are going to be shown here in the blue. So all of these blue structures are the cardiac veins. And the main one we want to talk about here is going to be where all of those blue veins, all of those deoxygenated blood is going to this structure. So this is my coronary sinus. So the coronary sinus takes all of these deoxygenated veins and dumps it into this right atrium, which you can see the opening of it right here. So it's going to be my right atrium, my right coronary sinus. So with this heart model, remember that the base of your heart has all the blood vessels entering and leaving it. And that's going to sit opposite to the apex. In humans, our heart sits in the diaphragm, and so it's going to turn over to the left side. In most of your other animals, it's going to tip straight down, as that's going to be the apex. But in us, we go over to the left. Let's go ahead and talk about the structures and the chambers of the heart, and then we'll talk about the vasculature of the heart. So the way the heart goes, you go from the right side, the right vena cava, right atrium, right ventricle, pulmonary artery, and then goes to the lungs. From the lungs, it goes from the pulmonary veins, pulmonary to the left atrium, and then to the left ventricle, and then to the aorta. So these are the vessels. We'll talk about the chambers and what's involved with them right now. So coming into the heart, we have our inferior vena cava and our superior vena cava. They're going to drain into this structure, which is going to be my right atrium. So the right atrium receives blood from the inferior vena cava, superior vena cava, and then also from its own blood supply. The heart has its own blood supply, and that's going to be my opening for my coronary sinus. So between the inferior body, superior body, and the heart itself, all of these deoxygenated venous blood goes to the right atrium. From there, it's going to pass into the right ventricle. Through this tricuspid valve. And on this model, you're seeing 3 leaves. 1, 2, 3. 1, 2, 3 leaves of this tricuspid valve. These right here are going to be my chordae tendineae, holding that valve in place. So as the blood vessels can pump, as the chambers pump, it doesn't force fluid backward. And then these structures right here would be my papillary muscles holding those chordae tendineae in place. Papillary muscles, chordae tendineae. The blood is going to then U-turn around as it's going from the left ventricle, from the right atrium to the left ventricle, passes upward through this structure, which is going to be my pulmonary valve, pulmonary semilunar valve. From there, it's then going to go up into the pulmonary artery, shown here in blue. And from there, it goes to the lungs. After it gets to the lungs, it gets oxygenated. And then when it goes back, it's going to go through pulmonary veins. So veins mean they bring blood towards the heart. Arteries means away. So these are taking red oxygenated blood from the lungs and into the left atrium. So these are going to be my 4 pulmonary veins. And those 4 pulmonary veins are going to go into this left atrium. The left atrium flows blood from the left atrium into the left ventricle through this valve, which is going to be my mitral, bicuspid, or left AV valve. And it has 2 cusps. You have one cusp over here, the other cusp here. So my papillary muscle, chordae tendineae. Papillary muscle, chordae tendineae. And from there, it's going to pass upward and U-turn and go to the pulmonary, to the aortic semilunar valve up through there. So left atrium, left AV valve, left ventricle, aortic valve, going down to this to the aorta. All right, this is going to be our section over the sheep's heart for review. So remember, a sheep is going to lay down. A sheep's going to be head here, tail by my wrist, and the heart's going to sit right down lower. So this right here is going to be the apex, the tip of it, and the blood's going to pump from the apex upward to the base. And my base here is going to be where my blood vessels all exit out of. Like this is my aorta right through here that's going to be presenting it. So remember, there are the 4 chambers of the heart. You have the atrium, both the left and the right, and then the ventricles, both the left and the right. So if I open up this up, you notice we have the 4 chambers. 1, 2, 3, and 4. So the 2 ones up here are going to be my atrium. So the first one we're going to see is going to be the right atrium. So my right atrium is right here. Right in here. It's going to feed into this larger right ventricle. You can see it also on this side, on the flip side. Here's going to be my right ventricle. Next chamber, as it goes from the right heart, from the right atrium to the right ventricle, the next one is going to be the left atrium as it goes from the lungs. So this is my left atrium. And then here's going to be the next chamber, the left ventricle. You know it's going to be the left ventricle because it's that much thicker. It's a lot thicker than this right ventricle. Both the left and the right ventricles have the valves, the mitral and bicuspid valve, tricuspid and bicuspid valve. They're held together by these chordae tendineae, which hold these valves in place and prevent the blood from going backwards into the atria. So these are going to be my chordae tendineae. And then they're held together by these papillary muscles here, connecting to them. Between my left and my right ventricle, I have the interventricular septum, the space between them, and that's where much of my electrical activity goes to and from the heart. Looking on this model, if we open this one up, left atrium, going through this one, which is going to be my tricuspid valve. It's hard to see, but you can kind of see the chordae tendineae right through there. Papillary muscles aren't easy to see in this one. Then it goes from the right ventricle through the pulmonary artery into the lungs. from the lungs, and then go backward to this left atrium. It goes through this, which is going to be my my mitral or bicuspid valve, and this right here, the chordae tendineae of that valve, connected to the papillary muscle, which is here. So chordae tendineae, papillary muscle. You also have the interventricular septum here between my left ventricle and my right ventricle. So once again, right atrium, deep to that valve, purgating the valve here is going to be my right ventricle. Here is going to be my left atrium. Deep to that valve, my chordae tendineae is my left ventricle.